One of the foremost aspects of our health is represented by a pleasing face which is proportional and symmetrical. Formation of the arch, jaw, and tongue position are together very important factors. They are foundational scaffolding that supports the overlying muscles and tissue that create what we identify as beauty and health. It is common to have distortion occur as a result of mouth breathing, allergies, deviated septum, and environmental factors. These changes not only cause facial deformities but also cause migraines, headaches, neck pain, TMD, and other sleep breathing disorders as the muscles contract or shorten from spasm. They also change the underlying skeletal structure, leading to an unattractive and painful changes throughout the body. Forward head posture like turtle head and changes to the spine, uneven hips, legs, and feet can become painful, compromise overall function, and form a narrow arch that can force the tongue back into the throat and block the airway, causing snoring, sleep apnea, and other breathing disorders. This affects both children and adults and has severe health consequences and complications. Incorrect breathing or mouth breathing is the root cause of facial distortion, which lead to tremendous physical stress, internal inflammation, and damage to the muscle kinetic chain and our internal organs. The muscle kinetic chains are one single sheath of fibrous layer running from the tongue to the toes called deep frontline fascia, which is generally the involved layer causing most types of postural, structural deviations and distortions leading up to severe referred pain elements. These imbalances create inflamed and sensitive hyper or hypotonicity in the muscle chains called trigger points. These are also responsible for our moods and behavior and our body's ability to self-heal naturally. To help you understand this better, let us introduce you to the body's largest organ, fascia. Now we want you to understand the continuity of fascia and thereby have a more functional approach in the way you will be able to understand and treat your pain. In recent years, thanks to the dissection studies by orthopedic surgeons and the clinical applications of these observations, we have learned that fascia cannot only cause local restriction and pain, but fascia has global mechanical continuity and thus plays an essential role in posture and movement. The illustration shows the continuity of fascia from the toes to the tongue. Starting with the foot, the calf muscle, inner thighs, and abductors are all connected. These adductors anchor into the hip flexors, the psoas, and the quadratus lumborum. Both these muscles anchor into crura of the diaphragm, creating a direct connection between respiratory, posture, and facial function. This continues through the thorax, the throat, the floor of the mouth, and the tongue itself. In other words, there is a direct mechanical connection between facial function, tongue function, diaphragmatic breathing, lumbar and cervical spinal posture, gait, and pain patterns. This helps explain why doctors and other practitioners have often seen dramatic improvements in posture and related pain patterns following a frenuloplasty. Fascia and skeletal muscle appear to have movement pattern memory such that forward head posture, which is known to be detrimental, may perpetuate restriction in the deep front line through postural habits. Let's consider a forward head posture concerning the anterior neck, jaw, and head. Protruding the head forward places the supra and infrahyoid under tension, causing a downward tension on the mandible and a tendency to mouth breathe. The same retreated mandible changes the occlusion of the teeth, and again retreating the mandible irritates or perpetuates irritation and can potentially perpetuate irritation of the retrodiscal tissues of the TMJ. Now this posture also places sternocleidomastoid called SCM muscle at a biomechanical disadvantage. This muscle is one of the most common yet poorly recognized cause of severe cervicogenic headaches. Postural retraining, myofunctional exercises, and when indicated as frenuloplasty all go hand in hand. So when we consider the continuity of the deep front line, it really makes sense that the frenuloplasty procedures can often be the key that unlocks a cascade of biomechanical improvement. Over time, it is commonly observed that individuals with malocclusion and improper tongue posture and movement may experience a narrowing of the airways. Individuals often engage in forward head postures to compensate for the narrowing of the airways. The above inference often lead to a range of chronic symptoms and conditions which are the fundamental cause of variety of chronic elements and symptoms. Here is a known connection: allergic reactions, chronic respiratory disorders, ADD and ADHD, diabetes, thyroid dysfunctions, hypertension, vitamin D and calcium deficiency, inflamed tonsils and adenoids, deviated septum, crooked and crowded teeth, migraines, fibromyalgia, knee pain, slip disc and lower back pain, cervical stiffness and spondylosis, TMJ, TMD and sleep disorders, strained and fatigue muscles, painful and sore muscles, plantar fasciitis, skin diseases, hyperacidity and reflux, digestive and malabsorption disorder, circulatory and cardiac disorders, chronic fatigue, daytime sleepiness, and many more. By simply returning the jaw to its normal, healthy, decompressed position with proper treatment which enhances breathing function continuously, in turn results in a range of biochemical enhancements, we can now help patients live a much healthier span and relief from most of the aforementioned symptoms. This is achieved through our patented oropostural neuromuscular appliances and myofascial equilibration process, which will relax the muscle spasm, allowing the muscles to return to their natural ideal length, strength, and ideal posture, resulting in lasting relief, recovery, and rehabilitation. Also, more pleasing posture and position that is symmetrical and physiologically comforting and healthy. This understanding of the fascial continuity and myotherapy based techniques that can resolve chronic pain disorders, namely fibromyalgia, lower back pain, sciatica, slip disc and herniation, knee and joint pain, arthritic pain, cervical and referred pain, headaches and migraines, respiratory and sleep breathing disorders by improving functions without going through long-term usage of painkillers, massages, expensive therapies, lots of time to recover and living in constant discomfort in mobility so quickly is a game changer.